Hello and a warm welcome. You are watching Tracking COVID-19, our special half-an-hour program in which we tell you all the developments on the pandemic. We also get you inputs about steps taken by the administration and the global developments. All packed together in the next 30 minutes. Let's begin with the top updates. RBI says India expected to post a sharp turnaround in the financial year 2022 with 7.4% growth. Announces refinancing of NABARD, SIDBI and NHB, reduces reverse repo rate by 25 basis points. Government taking several steps for prevention, containment and management of COVID-19 through a collective effort with the states and union territories. Union Health Minister holds video conferencing with health functionaries and senior officials as well as field officers of World Health Organization on the containment measures for COVID-19 in India. Cabinet Secretary writes to all states and union territories to ensure safety, shelter and food security of migrant laborers. Urges states to direct all district collectors to immediately review the situation. All states asked to undertake a comprehensive enumeration of migrant laborers and stranded persons. Prime Minister Narendra Modi discusses with world leaders the ways to combat COVID-19, holds telephonic conversation with King Abdullah II of Jordan, Bhutanese Prime Minister Dr. Lotte Tshering. Prime Minister Modi reiterates India will stand by its close friends and neighbors in the fight against the pandemic. Total number of active COVID-19 cases in India crosses 11,000 with 437 deaths. Over 1,700 people have been cured and discharged. Maharashtra remains the worst hit while situation in Kerala improves. Confirmed cases of COVID-19 infection crosses 21,50,000 world over. Over 1,43,000 global deaths reported from the pandemic. United States continues to be the worst hit with COVID-19. Over 33,000 deaths, over 6,71,000 confirmed cases. Portugal extends national lockdown for another fortnight. Lockdown to continue in Britain till May 7th. Bangladesh records 341 new cases of coronavirus in the last 24 hours. PM Sheikh Hasina contemplating taking services of retired doctors and nurses. Well, those were the top stories. Let's now first take stock of the developments in India in Ground Zero. Amid the novel coronavirus pandemic, RBI Governor Shaktikanta Das met the media in a special press conference on various measures taken to boost the economy. RBI Governor expressed his gratitude to the healthcare workers. He said that RBI is monitoring the situation closely. Shaktikanta Das said that the Indian economy is expected to record a sharp turnaround at 7.4% in the year 2020-21, 2021-2022.
On April 14, the IMF released its global growth projections, revealing that in 2020, global economy is expected to plunge into the worst recession since the Great Depression, far worse than what had happened during the global financial crisis. The IMF's economic counselor has named it the Great Lockdown, estimating the cumulative loss to global GDP over 2020 and 21 at around $9 trillion US, which is greater than the economies of Japan and Germany combined. Within this downturn, the projections are replete with even sharper declines in output in various countries. India is among the handful of countries that is projected to cling on somewhat tenuously to positive growth at 1.9%. In fact, this is the highest growth rate among the G20 economies as estimated by the IMF. India is expected to post a sharp turnaround and resume its pre-COVID, pre-slowdown trajectory by growing at 7.4% in 2021-22.
Let's now take a look at some number crunching with regards to the cases or active cases of COVID-19 in India. It stands and it climbs to 11,201. That's the latest figures. While 1,748 people have been cured or discharged from hospital, the number of fatalities stand at 437. The total cases so far is 13,387. Maharashtra remains the worst hit state with over 3,205 cases and 94 deaths, followed by the national capital Delhi, which has 1,640 cases and 38 deaths. Madhya Pradesh, Rajasthan and Tamil Nadu have also reported more than 1,000 cases. The Government of India is meanwhile taking several steps for prevention, containment and management of COVID-19 through a collective efforts with the states and union territories. These are being regularly reviewed and monitored at the highest level. Dr. Harshvardhan, the Union Minister of Health and Family Welfare, on Thursday held a video conferencing with health functionaries and senior officials as well as health officers or field officers of the World Health Organization on the containment measures for COVID-19. WHO National Polio Surveillance Network team will support the Ministry of Health and Family Welfare to further strengthen the ongoing surveillance and response based on transmission scenarios and testing of cases. Dr. Harshvardhan also held an interaction with the Indian industry leaders organized by the Confederation of Indian Industry, that's CII, where he thanked them for contributing to the PM CARES Fund. He assured them that the government is aware of the difficulties faced by them and allayed their concerns with respect to the measures being taken for the revival of the economy. He also encouraged them to make the best use of the Make in India opportunities in healthcare posed by COVID-19 so that the country comes out more resilient and self-reliant in providing critical healthcare equipments. Well, there has also been a great deal of importance to the welfare of migrant laborers and stranded persons during the implementation of lockdown measures for the containment of COVID-19 in the country. Cabinet Secretary has written to all states, union territories to ensure that the effective implementation of detailed guidelines issued by the Ministry of Home Affairs for ensuring safety, shelter and food security of migrant laborers is followed. Cabinet Secretary has urged that all districts may undertake a comprehensive enumeration of migrant laborers and stranded persons and make all necessary arrangements for providing food and shelter to them. Psychosocial counseling may also be provided to such persons as per the guidelines issued by the Health Ministry in this regard. Ministry of Home Affairs, meanwhile, has notified some more activities that are exempt from the lockdown measures from April 20th. These activities include non-banking financial institutions, including the housing finance companies and microfinance institutions with bare minimum staff and cooperative credit societies. Those are the NBFCs, the cooperative credit societies that have been exempted from, when there's going to be a partial lift to the lockdown on 20th of April. More construction activities in rural areas included in the exempted list. These include supply and sanitation, laying and erection of power transmission lines and laying of telecom, optical fiber and cable along with related activities are also exempted. Some more plantation activities including bamboo, coconut, aronut, cocoa and spices plantation and their harvesting, processing, packaging, sale and marketing are also in the exempted list. Collection, harvesting and processing of minor forest produce by scheduled tribes and other forest dwellers in forest areas are also some of the things that are exempted from the lockdown measures. Well, after taking a look at all that the government is doing, it's now time to get you some updates that inspire hope and positivity in tackling COVID-19 outbreak. Well, COVID sample collection kiosk or COVSAC has been developed by the Defense Research and Development Laboratory in Hyderabad. DRDL is a missile system laboratory that comes under the DRDO. The kiosk will be useful for healthcare workers while taking COVID-19 samples of infected patients. This unit will reduce the requirement to change personal protective equipment by the health workers. The shielding screen of the kiosk will protect the health professional from droplet or transmission while taking a sample.
Defense Research Development Laboratory DRDL Hyderabad has developed a state-of-the-art kiosk for combating COVID-19. The kiosk, named COVSAC, will be used by healthcare staff for collecting samples from suspected infected patients. Patient under suspect will walk into the kiosk and a nasal or oral swab is taken by healthcare worker from outside. After the patient leaves the kiosk, 4 nozzle sprayers mounted in the kiosk cabin disinfect the empty chamber by spraying disinfectant mist for a period of 70 seconds. The kiosk is automatically disinfected without the need for human involvement. The kiosk is ready for next use in less than 2 minutes.
We are using this glow box type for the titanium welding. With this, keeping in this mind how to utilize it for the COVID thing, we have done small innovation and made this container. So whether the doctor will be outside and taking a sample for the patient being inside. So the technology has been designed with taking the missile containers into the queue, and it's an airtight container where there is no chance of any virus coming out. So this kiosk is a dual purpose kiosk. When it is put in a hospital application, we are able to, the patient goes inside and the doctor is outside. This can be used in a reverse mechanism in a community testing when we want to do it, where many people are doing in the country.
The DRDO has developed these units at the request of ESI Hospital Hyderabad as part of protective measures for healthcare workers. Now, several hospitals in Hyderabad and elsewhere in Telangana are asking DRDL to provide these kiosks, which cost 1 lakh rupees each. Suprashanti, Bureau Report, Doordarshan, Hyderabad.
Well, let's now take a look at this report filed by a Telangana correspondent. She tells us how amount transfer under the Pradhan Mantri Jan Dhan Yojana is helping to buy household items as there is no work due to the ongoing lockdown. Let's listen.
The central government is providing an ex gratia of 500 rupees per month to the account holders of Pradhan Mantri Jan Dhan Yojana. The financial assistance, which is being provided for 3 months from April this year, is meant to help the Jan Dhan account holders who are facing hardship due to lockdown. The amount is being credited to Jan Dhan bank accounts held by women. The first installment was released a few days ago, and the same equal amount will be credited to their accounts in May and June this year. In Telangana, about 38% of total population of 3.52 crore has Jan Dhan accounts. Out of them, 20% women have these accounts. The banks have deposited 500 rupees into the Jan Dhan accounts held by women in the state few days ago. Women beneficiaries are expressing joy over the financial help being provided by the central government. Salila Begum of Yadadri Bhuvanagiri district of Telangana said that the ex gratia amount is helping to buy household items as there is no work due to ongoing lockdown.
जनधन खाते में जो 500 रुपये आ रहे हैं गरीबों को, जो मदद मिल रही सेंट्रल गवर्नमेंट की तरफ से, तो डेली मजदूरी करके रोज़ रोज़ अपना पेट पालते हैं, वैसे लोगों के लिए ये 500 रुपये भी बहुत बड़ी बात है। बहुत बहुत शुक्रिया।
The Pradhan Mantri Jan Dhan Yojana, which is aimed at providing at least one bank account to every household in the country, is helping the poor to tide over the present disruption triggered by lockdown. Suprashanti, Bureau Report, Doordarshan, Hyderabad.
Well, Sri Chitra Tirunal Institute of Medical Science and Technology, the Central Institute in Thiruvananthapuram, has achieved a remarkable feat in the fight against COVID-19. In perhaps a first, it has developed a test kit named Chitra Gene Lampen to confirm the N gene of SARS-CoV-2 using a unique technology named RT-LAMP. The National Institute of Virology, Alapura, has validated the test kit and has intimated the same to ICMR. SCT Institute is in process of transferring the technology to industry for mass production. The new test kit can reduce the cost immensely, as per test kit will cost only 1,000 rupees compared to the 2,000 to 2,500 that one spends for the PCR kit. The new machine will cost just 2.5 lakh, whereas the RT-PCR machine costs roughly around 15 to 40 lakh rupees. It will just need 2 hours to test a sample, and the single shift can take as many as 30 samples. The low cost and scalability will help to take the test to all district hospitals and rapidly expand our potential for mass screenings if required. The underlying technology involves identifying the N gene of SARS-CoV-2 using of virus. The technique reverse transcriptions loop mediated amplification of viral nucleic acid. In good news now from Uttar Pradesh, Upeda's Gram Pradhan Meghraj Singh has installed 64 CCTV cameras and loudspeakers in the entire village of Hapur district. The village is being monitored in 3 shifts. If anyone comes out of their house or on the road, then they are being informed over the sound mic to stay at home and follow the lockdown strictly.
गांव में बहुत अच्छी तरीके से लॉकडाउन का पालन हुआ है और पूरे गांव में सीसीटीवी कैमरे द्वारा निगरानी रखी जा रही है और लाउड स्पीकर द्वारा सबको ये कहा जा रहा है कि कोई भी अपने घर से गली मोहल्ले में ना घूमे, घर से बाहर ना निकले।
हमारे गांव में ग्राम प्रधान द्वारा कोरोना वायरस से लड़ने के लिए 64 सीसीटीवी कैमरे लगाए गए हैं, जिनसे हर गली, हर मोहल्ले, हर चौराहे पर नजर रखी जा रही है। यदि कोई व्यक्ति बाहर चौराहे पे या गली मोहल्ले में दिखता है तो उसे लाउड स्पीकर द्वारा प्रेरित किया जा रहा है कि अपने घर पर रहे, बाहर ना निकले।
हर गली मोहल्ले में लाउड स्पीकर लगे हुए हैं और सीसीटीवी कैमरे द्वारा और लाउड स्पीकर द्वारा लोगों को लॉकडाउन का पालन करने के लिए प्रेरित करा जा रहा है, जिसका लोग पूर्ण तरीके से पालन कर रहे हैं।
Well, a great initiative there by the people of Hapur to see to it that the villagers follow the lockdown rules. Well, now moving to some international stories and news that bring hope. British Emergency Service have congratulated 99-year-old war veteran Tom Moore on raising more than $16 million for the health service by completing 90 laps of his garden. The retired army captain, who had used a walking frame with wheels since breaking his hip, set himself the target of walking the 25-meter around his garden 100 times before his 100th birthday that falls on April 30th. Moore served in India, Burma and the Sumatra during World War II. He said the walk was inspired by the care he received from Britain's state-run health service as the NHS when he broke his hip and when he was treated for cancer. Well, let's now scan through the developments from across the globe in World Wrap. Well, talking about numbers, the deadly novel coronavirus has infected over 21,50,000 people across the globe and has left over 1,45,000 people dead. The worst affected remains the United States of America, which has recorded over 6,71,349 confirmed cases and over 33,286 deaths due to COVID-19. Recoveries were registered at 56,236 people. Amidst the crisis, President Donald Trump has issued guidelines under which state U.S. governors could act to revive the U.S. economy from a shutdown in a staggered 3-stage process. The guidelines recommend that states document a downward trajectory in cases of coronavirus and flu-like illnesses for 2 weeks before beginning a 3-phase process to return to near-normal work and social life. States should document another 2 weeks of declining cases before proceeding from one phase to another. Schools, daycares and bars shouldn't reopen before phase 2, while restaurants, movie theaters and sports venues could open in phase 1 if they practice strict social distancing. Speaking at his daily briefing of the coronavirus issue, Trump argued that a prolonged shutdown could be deeply harmful to the U.S. economy and society.
Our country has suffered. The world has suffered. 184 other countries have suffered. Therefore, my administration is issuing new federal guidelines that will allow governors to take a phased and deliberate approach to reopening their individual states. Our approach outlines 3 phases in restoring our economic life. We are not opening all at once, but one careful step at a time. And some states will be able to open up sooner than others.
The second worst affected is Spain, with the overall number of infected cases rising to 1,84,948, with the death toll rising to 19,315 people. Recoveries were registered at 74,797. Spain's health minister has said that the contagion curve was descending since the end of March, but health experts say it is too early to say the trend will not change. Meanwhile, Chilean author Luis Sepúlveda, best known for his book The Old Man Who Read Love Stories, died on Thursday due to COVID-19 in a hospital in the region of northern Spain, where he lived for several decades. After US and Spain, Italy is the third country with the highest number of COVID-19 cases. According to the tally of Johns Hopkins University, the total number of positive COVID-19 cases in Italy stood at 1,68,941. The total number of fatalities in Italy stood at 22,170, while 40,164 persons have recovered till now. But Italy continues its 6th week in a nationwide lockdown, and swabs for citizens and sanitization of everything from street to shops to hospitals have become the new norm. People with COVID-19 positives are being swabbed again at the end of their home quarantine period to see if they no longer had the disease. Medical workers in full protective gear tested people in the northern city from a camp to test people who have been in quarantine at home. In France, the coronavirus outbreak has claimed another 774 lives in the last 24 hours, bringing the country's total fatalities to 17,941 people. According to the health ministry, the number of virus patients hospitalized dropped by 474 and the number in critical care declined by 209. The total number of infections stand at 1,47,091 patients. Brazil's President Jair Bolsonaro has fired his health minister after weeks of infighting and threats over the country's coronavirus strategy. He was replaced by Nelson Teich, an oncologist who supported Bolsonaro's presidential campaign. The spread of the coronavirus in Brazil has accelerated to 30,425 confirmed cases, with some 200 fatalities per day, bringing the death toll in the country to 1,924 on Thursday. Meanwhile, authorities in Rio de Janeiro are restoring to creative methods to get people off the streets during quarantine by deploying drones. On Thursday, drones flew over the streets of Rio, issuing alerts to people via speakers that wherever they had gathered in crowds to stay indoors. Russian President Vladimir Putin, meanwhile, has postponed the May 9th Victory Day parade in Moscow's Red Square due to the COVID-19 pandemic. This year sees the 75th anniversary of the Soviet victory in World War II, and the annual military parade has not been postponed before. Putin said in a televised address that there was no choice that he had but to push back the event. He, however, said that the parade would still be held later this year, though he did not give a date. Several war veteran organizations had earlier appealed to Putin to postpone the parade. 27,938 confirmed cases have been reported in Russia, while 232 people have lost their lives due to COVID-19 pandemic. Meanwhile, in other updates, United Kingdom has extended nationwide lockdown measures for at least 3 more weeks. Stand-in leader Dominic Raab has asked the people to stay at home in order to prevent the spread of coronavirus. Britain has registered 13,759 deaths till now and has more than a lakh active cases. Well, Associate Professor of Medicine at AIIMS, Dr. Neeraj Nishchal, today tells us what precaution needs to be taken while dealing in currency notes.
Specifically with currency note, we have this tendency of counting it with saliva. So we are actually infecting the currency note. So it would be a wise way, I can say, that stop using saliva for counting currency, because you may be spreading this infection to your family members by doing that. So whenever you use or handle a currency note, it's always advisable to maintain your hand hygiene. That's the best way. Wherever plastic currency can be used, I mean online banking
Yes,
or
online
net bank
transactions,
facility
yes.
can be used, you use that thing and you will be safe.
Well, that was an extract from Doctor Speak, a program that comes from 2 to 3 every day on DD News. Well, that's all we have time for, but each one of you staying indoors and following all the guidelines is a superhero or a Shaktiman in our sight. A special thought for the kids who are feeling the heat staying indoors, cut off from their friends, enjoy the time learning new things, helping your parents in the kitchen, doing some non-flame cooking. Leaving you with an Oprah Winfrey thought that should help you. The more you praise and celebrate your life, the more there is in life to celebrate. Bye for now. We'll be back again same time, same channel. Until then, you take care, stay safe and be positive. Bye-bye.